Let's discuss Medicare Parts A, C, and D along with the Medicare enrollment process. Because Medicare Part B requires more thought and calculation for some federal employees and retirees, we've devoted an entire video to help with the decision-making process. Just go to youtube.com/GEHA Health and look for Medicare Part B. You can also find videos on how GEHA health plans work with Medicare and retirement, and how our FEHB dental plan can help reduce your dental expenses. Medicare Part A is commonly known as hospital insurance and is premium-free. Part A covers inpatient hospital care, skilled nursing facility care, home health care, and hospice care. Almost all federal retirees receive Part A without having to pay a monthly premium. Part A hospital insurance has deductibles and daily copays that are based on a 60-day benefit period. Benefit periods aren't that typical in the private insurance world, so an example may be helpful here. Let's say you were admitted to the hospital on January 1st and discharged on January 15th. Your Part A deductible would kick in, and this would be the amount you owe the hospital if you had no other insurance. If you were readmitted to the hospital on March 20th, regardless of diagnosis, this would trigger another Part A deductible because more than 60 days have passed since your discharge. If you stay in the hospital longer than 60 days in a benefit period, you have additional per-day copays from day 61 to day 90, and an even higher per-day copay from day 91 to 150, the last day of benefits. There would be no additional benefits available for this benefit period. It's worth noting that any day past day 90 is considered a lifetime reserve day, and you only have 60 lifetime reserve days available over your lifetime. In our 150-day example here, you would have used up your 60 lifetime reserve days. Almost all fee-for-service plans within the FEHB program pay Part A deductibles and copays on your behalf when Medicare is primary. One important thing to keep in mind is that FEHB plans have limitations on how much is covered for skilled nursing facilities after Medicare's payment. For this reason, you may want to look into long-term care insurance well before retirement. To find out more about long-term care insurance, visit the OPM website. Now, let's move on to Medicare Part C. Medicare Part C, or Medicare Advantage plans, are private health insurance companies approved by Medicare. To be eligible for a Medicare Advantage plan, you must also be enrolled in Medicare Parts A and B. These regional HMO or PPO plans provide hospital and doctor coverage and usually provide prescription coverage. Their premiums and out-of-pocket costs vary widely throughout the country and may be more limited in certain areas. Some may require referrals to see specialists or limit your choice of providers within their network, and may only pay for emergencies outside of their service area. If you enroll in a Medicare Advantage plan and also have FEHB coverage, FEHB plans generally will not waive their plan deductibles or coinsurance. In this case, you may want to consider suspending your FEHB coverage. Medicare Part D, the latest addition to the Medicare program, is for prescription drug coverage and has a separate monthly premium. Like Part C, private health insurance companies provide benefits. OPM has determined that federal retirees who are enrolled in a FEHB plan do not need to enroll in a Medicare Part D plan. Prescription drug coverage within the FEHB program, on average, pays out as much as the standard Medicare prescription drug plan. If you decide to enroll in Medicare Part D later, you will not have to pay a penalty for late enrollment as long as you keep your FEHB plan. Signing up for Medicare is easy. The Social Security Administration is responsible for the Medicare enrollment process, and the Centers for Medicare and Medicaid Services, or CMS, is responsible for the administration of Medicare once you're signed up. If you already receive benefits from Social Security or the Railroad Retirement Board, you are automatically entitled to Medicare Part A and Part B starting the first day of the month you turn age 65. You will not need to do anything to enroll. Your Medicare card will be mailed to you about 3 months before your 65th birthday. If you're not yet receiving Social Security benefits, you'll have to sign up for Medicare Parts A and B. Your window of eligibility is 7 months. It begins 3 months before the month you turn 65 includes your birthday month, and ends 3 months after the month you turn 65. If the window closes and you haven't applied, you'll have to wait until the general enrollment period from January 1st to March 31st to sign up. Coverage would then be effective on July 1st, and you may have to pay a penalty. Even if you don't plan on retiring before you turn 65, you should still apply. Remember, there is no premium for Part A, and you're entitled to it regardless of retirement status. Having Medicare Part A as a secondary payer will reduce your out-of-pocket costs should you be hospitalized, and it will help you keep more of that hard-earned money for retirement. The easiest way to sign up is online. Just go to ssa.gov/Medicare to begin the process. It can take less than 10 minutes to complete depending on your situation. Reviewing the checklist of required information prior to starting will speed things up. You can even save your application as you go and come back at a later time. In most cases, once your application is submitted electronically, you're done. There are no forms to sign, and usually no documentation is required. Social Security will process your application and contact you if they need more information. Otherwise, you'll receive your Medicare card in the mail. We've covered a lot of information, and there are probably some special situations out there that we didn't have time to cover. Remember, your best and most accurate sources of information on all things Medicare are the Medicare.gov and SSA.gov websites.